Hello everyone, this is the next and the most commonly asked LAQ in your exams, that is definition of the balanced occlusion, factors affecting balanced occlusion, and to enumerate the different types of complete denture occlusal schemes. So how will we move ahead with the answer? First we'll define balanced occlusion, then we'll discuss and write the different types of occlusion, and then we will write the factors affecting the balanced occlusion. So here's a comprehensive guide to the occlusal schemes in complete denture. So there are four different types of occlusal schemes. First is the canine guided occlusion, second balanced occlusion, third monoplane occlusion, and fourth is your lingualized occlusion. Canine guided occlusion, as the name suggests, it relies on the canine during the lateral contacts and the movements. Balanced occlusion, it ensures simultaneous contact of teeth on both the sides for stability. Monoplane, as the name suggests, plane. It uses flat teeth on a single plane for simplicity and reduced forces. Fourth is the lingualized occlusion. It combines the aesthetics with stability by using lingual cusp for contact. So these four are very easy. Canine guided relies on canine. Balanced occlusion ensures simultaneous contact of teeth on both the sides. Monoplane uses flat teeth. Lingualized occlusion and uses the lingual cusps for contact. Now, there are main 5 factors which determine the balanced occlusion. One is your condylar guidance, second is your incisal guidance, third is your occlusal plane inclination, fourth is cuspal inclination, and fifth is your compensating curves. So, these are the 5 factors which determine the balanced occlusion. Condylar guidance, incisal guidance, occlusal plane inclination, cuspal inclination, and compensating curves. We will study each of the 5 factors in detail. So first, we will start with the introduction. That what is occlusion? The static relationship between incising or masticating surfaces of the maxillary or the mandibular teeth or tooth analogues. This is the definition of occlusion. You will need to mention this definition in your exams. Then we'll write the definition of balanced occlusion. The bilateral, simultaneous, anterior-posterior occlusal contact of teeth in centric and eccentric positions. Very important. You will need to write this whole definition and you can make the diagram for the same. This, either this or this. Making more diagrams will fetch you more marks in your exam. And then we'll move on to the different diagrams that shows the working side and the balancing side during the lateral and excursion movement. These diagrams shows that during the balanced occlusion, the posterior teeth contact on the working and the balancing side during lateral excursion, balanced occlusion showing anterior and the posterior tooth contact during protrusion. So simply what you have to draw two incisors, upper and lower, show the teeth that are in occlusion and make this arrow suggesting that it is during the protrusion movement. Simultaneously in this, you have to draw 2 molars, show them in occlusion and mention during the lateral excursion movement. Then comes the importance of balanced occlusion. So what is the importance? Why do we need balanced occlusion? First, it enhances the stability of the denture. You can skip this part, not necessary. Then you have to mention lever balance. It is the relationship of the tooth to its base of support. It is important when a bolus of food is placed in between the teeth on one side and a space exists on the opposite side. So first you have to write it enhances the stability of the denture. Then you have to write about the lever balance and placing the teeth such that the resultant direction of the force on the chewing side is on the crest or slightly lingual. There is a diagram for the same that I'll show you later. Placing the teeth close to the ridge, denture base covering as wide area as possible and reducing the buccolingual width of the teeth. So these are the points of the lever balance. So what is lever balance? Relationship of the tooth to its base of support. It is important that when a bolus of food is placed in between the teeth on one side, space will exist on the another side. And how can lever balance be enhanced? By these factors: placing the teeth close to the ridge, denture base covering wide, that is a snowshoe effect, reducing the buccolingual width of the teeth. Now we'll move on to the factors affecting balanced occlusion. First is the condylar guidance. Definition of each and every factor is very important and you will have to write those definitions in your exam. The mechanical form located in the upper posterior region of an articulator that controls movement of its mobile member. This is called as condylar guidance. There is something called as condylar guide inclination. That is what the angle formed by inclination of a condylar guide control surface of an articulator and a specified reference plane. That is the angle that is formed by the inclination of the condylar guide and a specified reference plane is called as condylar guide inclination. This is the mandibular guidance generated by the condyles traversing the contours of the glenoid fossa. It is duplicated in the articulator. The extent of duplication depends on articulator's capability, whether it is semi-adjustable or fully adjustable. Protrusive condylar guidance is obtained using protrusive records. Lateral condylar guidance is obtained using Hanau's formula lateral records. It is designated as an inclination or angle. Condylar guidance angle or inclination, it is expressed in degrees. This is the only factor that is obtained from the patient and is not under the dentist's control. So first you will write the definition of the condylar guidance inclination definition. Then you have to write few points that are very important. First, it is the only factor that is under patient's control and not under the dentist's control. It is expressed in degrees. Protrusive condylar guidance is obtained using protrusive records, while the lateral condylar guidance is obtained using Hanau's formula or the lateral records. It is duplicated in the articulator. The extent of duplication depends on the articulator's capability. This is the mandibular guidance generated by the condyles traversing the contours of the glenoid fossa. So these are the main points that you will need to mention. Next, you will write about shallow condylar guidance will cause less posterior teeth separation in protrusion and requires teeth with shorter cusp and flatter fossa to achieve balanced occlusion than a steep condylar guidance. So we will draw the diagrams for the same. First, let us have a look on the lever balance diagram. So this is very easy. When there is a bolus of food located over here, there is posterior teeth separation. This is called as lever balance. Then over here, this shows the movement of the condylar guidance in the articulator that is made by the glenoid fossa of your mandible. Now, the most important point, see over here there is a shallow condylar guidance. And over here, there is a steep condylar guidance. So when there is a steep condylar guidance, we will need to use teeth with longer cusp and deeper fossa to achieve balanced occlusion. Because steep condylar guidance will cause a lot of posterior teeth separation compared to a shallow condylar guidance. Next is your incisal guidance. The influence of the contacting surfaces of the mandibular and the maxillary anterior teeth on mandibular movements. Definition, very important. Same, as we had condylar guidance angle, over here we have incisal guide angle. It is the angle formed between the horizontal plane of occlusion and a line drawn in the sagittal plane between the incisal edges of the maxillary and mandibular central incisors when the teeth are in maximum intercuspation. Can you see this? This is your this C is your incisal guide angle when the maxillary and the mandibular teeth are in maximum intercuspation. It is also expressed in degrees established during trying. Condylar guidance, it is on the patient. The dentist cannot set the condylar guidance. Incisal guidance, it is established during trying. If the angle is steep, it requires steep cusp. If it is steep, it will require steep cusp, steep occlusal plane and a steep compensating curve to obtain occlusal balance. Hence, it should be as flat. So, incisal guidance should be as flat, close to 0 degrees as aesthetics and phonetics will permit. It should never be greater than the condylar guidance. Obviously, incisal guidance cannot be greater than the condylar. If your incisal guidance is greater than the condylar guidance, it can lead to increased horizontal forces on your posterior teeth during mandibular movements, potentially causing problems like TMJ joint dysfunction and interfering with the condyle. When a steep vertical overlap is required for anterior teeth, a compensating horizontal overlap should be given to reduce the incisal guide angle. See, we can see in these diagrams, as we are increasing the vertical overlap, when we are using the steeper angles, steep teeth have been used, there is a compensating increase in your horizontal overlap. If steep vertical overlap is required for aesthetics, a corresponding horizontal overlap will help decrease the incisal guide angle. So what are the key points that you will need to write in your incisal guide angle? One is the definition expressed in degrees. It is established during try-in. If the angle is steep, we will require a steep cusp, steep occlusal plane and a steep compensating curves. It should be as flat or zero. When a steep vertical overlap is required for anterior teeth, the compensating horizontal overlap should be given. It should never be greater than the condylar guidance. You can draw these two diagrams. Over here, the teeth are in intercuspation and you can show them the incisal guide angle. And in this diagram, you can show that if a steep vertical overlap is required, then a compensating horizontal overlap will decrease the incisal guide angle. Next we move on is to the orientation of the occlusal plane. Occlusal plane is what? The average plane established by incisal and occlusal surfaces of the teeth, that is the occlusal plane. It is also related to your alar tragus line. It is established anteriorly by the height of the lower canine, which nearly coincides with the commissure of the mouth. Posteriorly, it is established by the height of the retromolar pad. It must be oriented in the same relation as when natural teeth existed, and hence there is not much scope to maneuver this factor. So what are the main points that you will write in the orientation of the occlusal plane? One is the definition related to the alar tragus line, anteriorly by the height of lower canine, posteriorly by the retromolar pad. It must be oriented in the same relation as when natural teeth existed. Done. Next, very important is your compensating curves. We will start with the definition. The anterior, posterior and the lateral curvatures in the alignment of the occluding surfaces and incisal edges of the artificial teeth that are used to develop balanced occlusion. So what are compensating curves? Anterior, posterior and the lateral curvatures in the alignment of the occluding surface and the incisal edges of the artificial teeth that are used to develop a balanced occlusion. It is determined by the inclination of the posterior teeth. The inclination of the posterior teeth will determine the curves and their vertical relationship to the occlusal plane. That will result in a curve that is in harmony with the mandibular movements as dictated by the condylar guidance, both protrusive and lateral. A steep condylar guidance will require a steep compensating curve for occlusal balance. We had discussed these points earlier. The curve that assists in producing balanced occlusion are, they have anterior-posterior curve and a mediolateral curve. Anterior-posterior curve runs in anterior-posterior direction and helps in obtaining protrusive balance. Mediolateral curve runs in lateral direction from one side of the arch to another and help in obtaining lateral balance. So far in compensating curves, first you will need to write the definition. How is it determined? By the inclination of the posterior teeth and their vertical relationship to the occlusal plane. That is how the compensating curves are determined. Then a steep condylar guidance requires a steep compensative curve for occlusal balance. Then there are two main types of curves that help in producing balanced occlusion. Anterior-posterior curve, mediolateral curve. Anterior-posterior runs in anterior-posterior direction, helps in obtaining protrusive balance. Mediolateral curves runs in lateral direction from one side of the arch to another and help in obtaining lateral balance. Anterior-posterior curve, that is a curve of Spee. It is established by what? The curve of Spee is established by the occlusal alignment of the teeth as projected onto the median plane, beginning with the cusp tip of the mandibular canine, following the buccal cusp tip of premolar and molar teeth, continuing to the anterior border of the mandibular ramus, ending with the anteriormost portion of the mandibular condyle. This curve assists in obtaining protrusive balance as it is anterior-posterior curve. So curve of Spee helps in obtaining the protrusive balance. Without this curve, it would be necessary to tilt the entire occlusal plane at an angle, raising it distally to obtain balance. This will destabilize the upper denture and cause damage to the Ryuge area, increasing the resorption in the bone. In that area, resorption of the bone. So, this is your curve of Spee. Can you see this part? You just have to draw this diagram, and looking at the diagram, you can define the anterior-posterior or the curve of Spee. The radius or steepness of the curve necessary to achieve balance is dependent on the incisal and the condylar guidances. So, in your anterior-posterior curve, you first have to write what is curve of Spee. Draw this diagram starting at the buccal cusp tips and then ending directly onto the anteriormost portion of the mandibular canine. Then you will need to write it assists in obtaining protrusive balance. And what will happen if the curve of, without the curve, what will happen? It will tilt the entire occlusal plane at an angle, raising it distally to obtain balance. that will destabilize the upper denture. Then the radius or the steepness of the curve necessary to achieve balance is dependent on the incisal and the condylar guidances. Next we move to the mediolateral curve. So in the mediolateral curve, first is the curve of Wilson, then we have the reverse curve or the anti-monsoon curve, then we have the curve of monsoon, and then we have pleasure curve. So there are 4 curves in the mediolateral curve. So you have to write the definition and draw the diagrams for same. All the diagrams are very easy. Curve of Wilson, this is a curve that is convex downward, and Wilson adopted this curve in setting the artificial teeth in balanced occlusion for complete denture. It is used to arrange molars. So 2 main points. It is a curve that is convex downwards. It is used to arrange molars. The lower teeth are inclined lingually, giving prominence to the buccal cusp and bringing them into heavy occlusal contact with the upper buccal cusp during the lateral movements on the working side. So you have to mention these 2 points. Next is the reverse curve or the anti-monsoon curve, a curve of occlusion that is convex upwards. That was convex downwards, this is convex upwards. Curve of monsoon is used to arrange molars, this is used to arrange first premolars. Curve of Wilson. Then we move on to the curve of monsoon. Curve of occlusion in which each cusp and incisal edge touches or conforms to a segment of the surface of a sphere 8 inches in diameter with its center in the region of glabella. So, curve of monsoon is nothing but in which occlusion in which each cusp and the incisal edges touch to form a sphere with 8 inches in diameter and the center of the sphere is in the region of glabella. That is your curve of monsoon. Next we move on to the pleasure curve. The definition is a little tricky, but you can definitely draw the diagram and try to explain it in your own words. In excessive wear of teeth, the obliteration of the cusp and formation of either flat or cupped out occlusal surfaces associated with the reversal of the occlusal plane of the premolar, first and second molar teeth, whereby the occlusal surfaces of the mandibular teeth slope facially instead of lingually, and those of maxillary teeth incline lingually. Usually the maxillary teeth incline facially and the mandibular teeth are lingually, but in pleasure curve it is just the opposite. So pleasure curve is nothing but the combination of monsoon and anti-monsoon curve. As we had said, monsoon sphere of 8 inches diameter, center in the glabella, and anti-monsoon curve is nothing but convex upwards used for first premolars. It was used for arranging non-anatomic teeth. Why? Because pleasure curve is usually seen when there is excess of wear of the teeth or the obliteration of the cusp and there is formation of either flat or cupped out occlusal surfaces. The first premolars and first molars are set in a reverse curve to prevent the buccal tipping and seat the denture. The second molars are set in conventional monsoon curve to provide eccentric lateral balance. So basically in your pleasure curve you have to write it is a combination of what? Monsoon and anti-monsoon curve used for arranging non-anatomic teeth. First premolars and first molars are set in reverse curve to prevent buccal tipping and seat the denture. Second molars are set in conventional monsoon curve to provide eccentric lateral balance. In pleasure curve, maxillary teeth incline lingually, mandibular teeth slope facially, which is not in the ideal cases. Now we move on to the diagrams of each and every curve. This is curve of Wilson, convex downwards, reverse curve, convex upwards, monsoon curve 8 inch with all the occlusal. This is the glabella center and this is the pleasure curve. The premolars and molars are set in reverse curve and second molars are set in the monsoon curve. Now we move on to the last factor that affects the balanced occlusion, which is a cuspal inclination. The angle made by the average slope of a cusp with the cusp plane measured mesiodistally or buccolingually, also called as cusp angle. So definition, as usual, it is very important. This has effects on the occlusal plane. Cuspal inclination, obviously it will have effect on the occlusal plane and the compensative curve. The closer a tooth is located to incisal or condylar guidance, the more influence the guidance has on cuspal inclination of that tooth. Because we know incisal guidance is what? It is nothing but the cuspal inclination of the upper and the lower central or lateral incisors. In anatomic teeth, it is preferable to eliminate the mesiodistal cusp height, as then only the buccolingual incline needs to be considered for balanced arrangement. In anatomic teeth, what do? We eliminate the mesiodistal cusp height. Then only the buccolingual incline will be arranged and considered for a balanced arrangement. In cuspal inclination, you have to write the definition, what effect it has. It has effects on the occlusal plane. closer the tooth is located to incisal or condylar guidance, the more influence that has on the cuspal inclination. See, can you see this is nothing but you have to draw a teeth and then write about the cuspal inclination. Determining the angle which is formed by the incline of a cusp with the horizontal plane, we can see this is the angle, cuspal inclination. This is nothing but a Hanau's squint. So it has all the different factors that affect the balanced occlusion. Then comes the Thielman's formula. This also describes the interrelationship of the 5 factors affecting the balanced occlusion. So in other terms, balanced occlusion is directly dependent on condylar guidance and incisal guidance, and indirectly it is dependent on occlusal plane, cuspal inclination and compensating curve. More deeper the compensating curves, the balanced occlusion will be affected. So this is all the important factors that you need to write in the balanced occlusion. The definitions for each and every factor. Very important to mention that the cuspal inclination, condylar guidance, Thielman's formula, compensating curves and everything. So these are the 5 main factors that affect the balanced occlusion. It is very important to draw the diagrams that it will help you fetch more marks. Next comes the monoplane occlusion. In monoplane occlusion, we just have to write an occlusal arrangement wherein the posterior teeth have masticatory surfaces that lack any cuspal height. This occlusal arrangement is used in non-anatomic teeth. Anterior teeth are arranged with an overjet of 2 mm and no overbite. So that is a very important point in monoplane occlusion. First, the definition used for non-anatomic teeth. Anterior teeth with an overjet of 2 mm and no overbite. And although balanced occlusion and eccentric relation is not a part of the occlusal scheme, it may be developed using compensating curves and balancing ramps. What are the advantages? Easy to arrange teeth. Simple non-adjustable articulator is sufficient. Easier occlusal scheme to achieve, especially in the following conditions. In which conditions? Skeletal malocclusion, severe residual resorption, difficult to obtain accurate centric relation records. So in monoplane, first the definition used for non-anatomic teeth. Anterior teeth with an overjet of 2 mm and no overbite. Advantages are what? Easy to rearrange. Simple non-adjustable articulator is more than enough. And following conditions: difficult to obtain accurate centric relation records, skeletal malocclusion and severe ridge resorption. So this is the diagram of a monoplane occlusion. You can simply draw this diagram in your exams. And in this diagram we can see the balancing ramp which is given when we use monoplane teeth to achieve the balance. Then comes lingualized occlusion. This form of denture occlusion articulates the maxillary lingual cusp with the mandibular occlusal surfaces in centric, working, non-working mandibular positions. So, definition once again very important. This combines balanced and monoplane. So, lingualized is nothing but balanced occlusion plus your monoplane occlusion. That is your lingualized occlusion. Although 5 factors involved in balanced occlusion play a similar role in the arrangement of teeth with this scheme also. What are the advantages? More natural appearance of the upper premolar teeth, better chewing than monoplane occlusion. Disadvantages: more challenging teeth arrangement, no scientific data to show improved stability and cannot be applied due to difficult situations. So practicality, if we go on to see, there is no use of lingualized occlusion. And here's the diagram for the same. So with this we complete our LAQ for the balanced occlusion. Very important is the definition of the balanced occlusion, to write and enumerate the different occlusal schemes and explain them at least in one word line and draw a diagram for the same. Write all the 5 factors that affect the balanced occlusion, the Hanau's squint, Thielman's formula, and you're good to go. Make sure to draw diagrams as much as possible because it gives the examiner the feeling that you know the answer. So diagrams are very important. Thank you friends, and do let me know what next LAQ you want me to solve for you people. Thank you.